we're back from the break, and in this segment we're going to be focusing on science again with Barbara, who will be interviewing Dr. Michael Dailey of the Albany Med about
emergency care for cardiac arrest.
Now that's something that affects us all. Nick, you have a story on that, right?
Sure, I had bypass myself 14 years ago.
People don't understand how important with the emergency, how the time is ticking. Every second counts.
That's right. Every second counts. If someone's having a heart attack, you could save a life. Every family member and friend has been affected. So this was a very, very important topic today.
Yeah, it's going to be one that you don't want to miss. So
right.
Let's watch now.
Thanks, guys. We're here talking with Dr. Michael Dailey. He's our guest today for the science segment on impact. Dr. Dailey, you hail from Albany Medical Center, the emergency medicine group. I welcome you here to the show. We're here today to talk about cardiac events and how they impact our lives and what the best practices to do are for our viewers out there in the community. So, how long have you been doing this?
Well, Barbara, that's an interesting question because I've had a lot of different hats as I've worked towards becoming an emergency physician, and now my current role as an associate professor at the medical college.
Mm-hmm.
I've worked as an EMT in the field. I've worked in the field on helicopters, actually, and ultimately through many different EMS systems or care delivery systems in the field. Now, as regional EMS medical director, hopefully I'm impacting care in 6 counties, and I think we've made some significant advances over the course of the last 10 years.
So your unique perspective of having come from the firehouse, the flight medic situation, and the hospital, you've been able to see all the different pieces of connecting the dots of the call to 911 until the care in the hospital.
It's important to recognize every situation is very different and very personal. But when we look at them all in aggregate or look at them all together, we can come up with ways that we can impact care and ultimately increase survival from some of these events. And we've been able to bring some of those plans right through into each individual squad in the 6 counties around Albany.
So let's talk about an event. Let's unfortunately talk about what happens every day in our community. That is, someone thinks they're having a problem with their heart.
Mm-hmm.
What's the first thing to do?
The single most important thing to do if you think you're having a problem with your heart or someone around you recognizes that you look like you're becoming profoundly ill is to call 911. The professional paramedics and EMTs that we have in our community will be able to provide the next steps in care. In fact, that's even going to start as you're talking on the phone to the dispatchers, because our dispatchers are all professionally trained to do emergency medical dispatch, provide pre-arrival instructions that may be life-saving, and ultimately impact outcome in the end, depending on what the event is.
So there's a value to the medical care that you're getting over the phone as the EMTs and paramedics are coming to your home.
Absolutely. Absolutely. If there are different things, heart attacks and sudden cardiac arrest, in both cases we've created programs within the centers that deal with most of our advanced cardiology practices in this area, which ultimately change outcomes. Heart attacks, where a blood clot will block one of the blood vessels going to the heart, impacting how the muscle of the heart will beat, we treat by getting an immediate electrocardiogram or EKG in the field, just like we would in the doctor's office or in the hospital. We can then transmit that to be looked at in the hospital so that then our cardiology teams can come in from home and treat you as soon as possible.
So they've already looked at your EKG possibly. As the first responder has sent that information off to the hospital, a cardiologist is reviewing it and already evaluating what type of heart attack you're having.
Right.
Wow.
In this current healthcare climate where there's a lot of competition between centers, the one thing that the centers don't compete over is whether or not we ultimately will end up with better care for our patients. That system, we call it a STEMI for ST elevation MI, or a specific kind of heart attack. We actually had a collaborative program several years ago between the Albany Medical Center, the physicians and the Ellis Cardiology Group in particular, the Ferrioli Foundation, who's a local foundation that helped us out with funding, CDPHP, and St. Peter's. And the group all worked together in order to bring a system that would allow all of the EMS providers to transmit electrocardiograms into the EMS physicians in the emergency department and reduce what we call our door-to-balloon time, or the amount of time that it takes for the blood vessel to be opened and blood to flow freely to the heart the way it's supposed to.
Which is ultimately a lifesaver.
Ultimately a lifesaver. Makes a difference in terms of the survival of the muscle, which then means how well the heart will beat, which ultimately means how well the blood will flow through your body and how well you will be able to continue to return to your daily life.
Okay, so you've made the call to 911. The 911 dispatcher is giving you instructions. The EMTs are on the way. Say your family member's in the home and we have an unconscious individual. What's the next step?
So now we're talking about something that's not just a heart attack, but also something we refer to as cardiac arrest or sudden cardiac death. The dispatcher will talk you through evaluating that person and deciding whether or not compression should be begun. And something we used to always do was something mouth-to-mouth resuscitation and compressions of the chest. We now are encouraging people to just do compression-only CPR, so you don't have to worry about doing mouth-to-mouth as well.
Is that because it takes vital time away from the compressions of actually circulating the blood through the rest of the body, if you're doing the mouth-to-mouth?
There are actually a number of different reasons. The first is the more we do compressions, the more we circulate blood, the better we circulate the blood, and the better ultimately the outcome is. That's number one. Number two, going between doing compressions and doing mouth-to-mouth and doing compressions and mouth-to-mouth is really hard to do. And it takes a little bit of time to figure out how to do this correctly, and it's time away from those compressions. And the other reason is doing mouth-to-mouth is profoundly gross. And because it's gross, a lot of people don't want to do it. And ultimately, it's doing the compressions that give the EMS providers the chance to restart that heart. And if you restart the heart in the field, that's the only chance that person really has for a meaningful recovery to go back to the life that they had before their event.
So if you've done cardiac compressions, the EMTs have gotten there and they've checked and there's still no pulse, is there any hope whatsoever?
Absolutely.
Okay.
Absolutely.
So what happens next?
So you've been doing compressions on your loved one who you watched go down in front of you. EMS providers will arrive, and it will probably begin with a first responder of some type, and that's going to depend on which community you live in. It could be a firefighter, it could be a police officer, a sheriff's deputy, New York State trooper. It could be an EMS provider. They'll put on what's called an automatic external defibrillator, and that'll begin to evaluate a heart rhythm and allow us the opportunity to, if the heart allows it, all right, if the heart is in the right rhythm, to shock that heart and restore a normal rhythm.
Those are the AEDs we see in the malls and in the schools?
The AEDs we see in the malls, the schools, and just like the one we have in the office here at Proctor's that I noticed sitting right next to the receptionist desk.
Excellent. Great. So now what?
Now the next step is, if the person required a shock, they get a shock. We then continue doing compressions. We keep on trying until we make a decision that actually there's nothing else we can do, which is sad but unfortunate. The reality is that sometimes cardiac arrest is a terminal event and that person will be dead. And many times we actually get them back. In the town of Colony, for example, in someone who can get a shockable rhythm, or someone who has a rhythm that we can push that AED or regular defibrillator and shock the person, we get them back about half the time and get them to the hospital.
So half the time. Wow. And the chances if you just call 911 and hope for the best?
If you call 911 and hope for the best, the chance is less. But recognize some things that are important. One is that cardiac arrest is sometimes a terminal event. And if that person was down when you found them and had no pulse when you found them and nothing happened from there, the chance of getting them back is very, very low. If, on the other hand, they go down in front of you and you initiate compressions, the chance of getting them back is much, much better. Each case is different, and there's no way to really look at all of these cases universally, because in some cases people just have a lot of illness. But in other cases, and I can rattle off the names, Kelly, Michelle, John, Bernie, they come from many different parts of our community.
They're out there.
And they're out there, and they're your neighbors and friends. These people were active in their daily lives. They went down. People saw them go down, initiated bystander CPR. They got shocked. They were taken to a hospital, much like Albany Medical Center, where we did the first therapeutic hypothermia case back in 2009. Those therapeutic hypothermia cases where we chill somebody down after they have one of these events and prevent additional ongoing brain damage, these people have all returned to a normal life. And this is now being done at Albany Medical Center and at Ellis and also at St. Peter's now.
Terrific work. Dr. Michael Dailey, thanks a lot. Thanks for saving our lives, and thanks for telling us how to save the lives of our loved ones.
A pleasure. Thank you very much.
Thank you.